You can probably look at this one. Yeah. Okay, you're live over there. All right.
Mm-hmm.
If you want to talk real quick.
Hi guys, it's Dr. Habib. Looking forward to engaging about the coronavirus. Just waiting for people to get on. Is it live?
Yeah, it's live.
It's on, so people can actually see.
Yep.
You keep talking.
Yeah. We're gonna give it a few minutes.
Cool, Mom.
Should I come down?
Yeah, so looking forward to people joining slowly. So let's give everybody a few minutes. I had an interesting day today, so I can utilize some of the feedback that I got talking to somebody on the phone and then somebody in real life. And of course, there's a lot of new things going on with the information coming out, the TV, the news, the president, and it seems to be changing and evolving, and rightly so. Rightly so. I think in this kind of pandemic, it's better to be proactive. And so I think that it is very important that we continue this kind of conversation as things evolve, as information comes out. Just talking about the news, it's very interesting how the data that we got from China about the number of infections and the number of deaths seem quite different to what's going on in Italy. Of course, a different country. There is some talk about this virus may be able to mutate. So what we're dealing with now may be different to what the Chinese were dealing with. It's just as you hear about more information, and now you're hearing that France are having a kind of a lockdown. UK will probably follow. So that is the true definition of a pandemic, is when you've got multiple countries being affected. There may be a lag, but nevertheless, each one's catching up. So when Washington State first started off showing these infections, and then now New York is, I think, outpacing all of them, it's good to see that each state is taking proactive steps ahead of government assistance or government direction. But what I wanted to talk about is a little bit more of the day-to-day of what real-life people are dealing with and the questions that they may have. And those are the kind of things I want to be able to go through. So now we can start looking at some of the questions that people are going to ask. But let me just start off with some of the practical advice. So what you've heard is that there's going to be a curve. And what we're trying to do is avoid the steep curve, because if the curve is high, that means a large number of people will be infected at any one time, of which even a small percentage might flood the hospital system, particularly the intensive care unit. That's what they're afraid of. So as Dr. Fauci is mentioning, is that if we can slow that down where the peak is more of a steady rise and maybe even a longer duration, that percentage of those people that end up needing intensive care or high-level medical care, there'll be enough capabilities. So these quarantine mechanisms, just recently, I'm in the Virginia state, I have offices in Maryland, and in Maryland, I just heard that they are not only shutting down schools, they're going to shut down restaurants, except for takeout, shut down movie theaters, and that probably will come, it's already in DC as well, and now Virginia will probably follow in those steps. And the idea is to kind of mitigate that big, steep increase in numbers. And what we do now may pay off in the few weeks to come. Only time will tell. As I said, this virus that we are hearing about started in December when it first got reported in China. And then, you started seeing, Iran and Italy. Now it's going to France. It's going to be in every country, no doubt. And when we just had a few states, a few cases in Washington State, now it's spreading to other areas. So anyway, let's get into the meat of it, which is that, as far as the public health is concerned, the advice that you're getting on TV from the government are absolutely essential, and I don't think they're overrated. So safe distance, washing hands, as well as not touching your face. These are very good precautions. And now what they're saying is that, public gatherings, less than 10 people, so that you minimize the exposure. And if you continue to minimize the exposure over the next several weeks and maybe longer, then this human-to-human spread will go down, and then maybe there won't be such a big peak. We do expect numbers to rise, no doubt, but if they're more of a steady incline, a percentage of them are going to get sick. And that's what I want to talk about, is that, who should be worried? And this is a respiratory virus, which has a propensity for the lung. You've heard about that. But the young are spared. And the cases, even the ones from Italy who respond to me, when they mention that young people are also dying or having severe complication, you have to wonder if some of those young people have some underlying problems, because some of these young people may have cancers or some treatments to cancers like chemotherapy. Their immune system may be suppressed with medication or so forth. And secondly, which is not easy to see, is that no two people are equal. They may look the same on the outside, but if there's a difference, and that difference is what you don't see, their immune system. And there are many examples of this. You can have two diabetics, one gets a heart attack, one doesn't, when everything else may be the same. Well, the fact is that those two diabetics are not the same, because one diabetic may have some other factors like inflammation leading to the heart attack. You can have two people who are twins, and they have the same genes, and they look the same in every way, but the choices of the individual, the one that sleeps well, the one that eats well, the one that lowers the stress level, the one that has good bowel function, they're going to have a stronger immune system, so they're less likely to have inflammation, they're likely to have a stronger defense. Okay, so today I want to spend more time about what you can do proactively yourself, and so we'll focus on the immune system. And so let's start that conversation with, well, what's the difference between a virus and a bacteria? A virus generally is self-limiting. That means that it lives in the host for about a week, and then maybe maximum 2 weeks, then it passes away. Whilst the virus is in the body, most viruses don't want to kill the host, because the virus needs the host to be alive to sustain itself, unlike bacteria, which tries to destroy the structures. So in the case of a regular virus, it's contagious, right? How do you know it's contagious? It could be sore throat. It could be a runny nose. You could have a cough. You could have fever. The fever is not necessarily contagious, but it's a sign of an infection, right? Because a runny nose could be allergies. You wouldn't get a fever. So I would say that, there's the minor virus, the regular respiratory virus. There is the more serious flu-like virus. There is more of a comparison with the flu-like virus than this corona in terms of its severity and its contagiousness. But this is a pandemic, which means that unlike the flu, which is more of a seasonal thing, this one, we don't know, might hang around longer. And it is very infectious, no doubt. So people who are generally healthy generally escape, but they could be, you wouldn't use the word carrier, but they could have the infection without knowing it. So without knowing it, they could be exposing people. A true carrier is a different terminology, and that brings out the kind of more of a chronic state. That means, they could be carriers for a long, long period of time. Now, what we're talking about is somebody's infected, they just don't know about it because they have no symptoms or very mild symptoms. They're exposing themselves to older people who might get it at that point. It would be much more obvious. So let me change the pace. I'll tell you about a story of somebody on the phone. They reported that, look, I've had this sickness for about 2 weeks and maybe longer. I'm coughing and I think it's corona. So I just asked a few questions like, okay, have you had fever? Yes, I've had some fever. All right. And are you coughing up anything? Yes, I'm coughing up something. I said, well, what color is it? It's yellow. Is it a yellow throughout the day or just in the morning? It's yellow throughout the day. Well, that sounds like a bacterial bronchitis. And so she may have started with a virus, and the virus lingers, allowing a secondary bacterial infection. So not all infections are going to be viral, and not all infections are going to be corona, but a virus can leave the body in a state where you get a secondary bacterial infection. That one can be treated, so we would use an antibacterial. So that's a fairly straightforward one. I have somebody who was traveling from Florida, coming up to Virginia, not feeling well. He's at, in his hotel. He's got what he thinks is fever, maybe feeling cold. He's got a mild cough. He's got diarrhea, and so that combination is somewhat worrisome. So I said, wear a mask when you're traveling, and then when you come over this way, when you come to the office, call me before you come in. He did. So I met him outside the office, because in his situation, with a fever and a mild cough, and he also described shortness of breath. So in other words, if he's sitting, he's fine, but if he's walking, he's feeling a little bit winded. This is a young guy. In other words, he's in his upper 40s, young, very fit. And so that one, again, this is not just a simple respiratory virus with a sore throat, runny nose, a little cough. This is somebody that's saying that, look, I'm having shortness of breath, and I've got some atypical symptoms like diarrhea. And in addition, he's got this fever. And so the fever is a sign of infection. The higher the fever, could be viral, it could be also bacterial. So with this gentleman, what we did was we evaluated him outside the office, literally outside in the patio area. We took his temperature. He was actually hypothermic. So when people have fever, the body liberates the temperature, and then you get a temporary hypothermia. So whether you have a high temperature or a low temperature, they both indicate fever. And the way the patient would know is, I feel hot sometimes and sweaty, and other times I feel chilled. Well, that's because the body is trying to, combat that hypothermia. A common question that comes up when people have fever is, should I bring it down with Tylenol or Motrin? That is no. Unless you are really feeling very bad, where the fever is over 103, or you're just feeling bad and you can't tolerate the fever, that hypothermic state, is designed to combat all infections, actually, whether it's viral or bacterial. In fact, hypothermia is a way to combat cancer and many other things, which we will talk about in the future, about your body creating heat and hypothermia and how it produces what we call heat shock proteins, for another day. So the common thing about fever is you should let it be. Let it be. It's your way to combat and recover from the illness. So this gentleman had fever. When I examined his lungs, he didn't have any obvious signs. That's not always a definitive, because sometimes people have no signs on the lung exam, but the chest X-ray may be more revealing. But again, I'm not going to expose other people to this gentleman until I figure out what's going on. And then what else? His abdominal examination was fine. And so you've got this hypothermia, which is like having fever. He's got shortness of breath. I don't find anything on clinical examination. So with this gentleman, I deemed him contagious, right? So that's another thing. When you have a regular respiratory virus or you have the flu virus, you're contagious. If you're corona, you're probably more contagious. But it's reasonable to take precautions in each and every one of these situations. And so even a bacterial infection where you're coughing, you're bringing out into the air. And that's one of the reasons how people are contagious, because it's coming out as droplets in the air. So that's why people who are sick, who are coughing, it's better for them to wear the mask. Now, if you as a passerby wear a mask, there is apparently limited benefit in that, because it's just not airtight, okay? But when the person with the infection is coughing, it will be hopefully captured, more of it will be captured in the mask than coughing into the air. And what people have said is, cough into your clothes, things like that, okay? So in this scenario where the first telephone call was a virus, probably with a secondary bacterial infection, the treatment is an antibiotic. This looks like a viral infection. I don't know if it's an atypical virus, like the corona and the flu, where they can give you diarrhea and abdominal pains. It's not flu-like. He doesn't have sensitivity to bright light. His body, he's not complaining of achiness, and his fever and chills don't seem as severe as the typical flu. But so it could be the corona at a certain stage in the development of the corona, or it could just be a regular virus. And so for that reason, I drew blood, because from the blood I can decipher between a viral attack, where lymphocytes go up, or a bacterial attack where neutrophils go up. And so it will give me a clue. Liver enzymes can go up when you have a gastroenteritis, but liver enzymes can go up with this coronavirus. So more information will help me figure out what's going on. So in my office, I was able to put him in a separate suite where there is no patient, and I was able to give him hydration, and I gave him a peptide that focuses on boosting the T cells, which is a type of immune system that is good at fighting viruses, right? So we're going to now move to what are the other proactive things that you can do beyond hand washing, beyond wearing a mask if you're coughing, beyond don't touch your face. And should you be sick, what I advise with this gentleman is that now that I've given him my treatment, what's he going to do when he goes home? What he should do is go to the basement. What he should do is find a part of the house where he's not with everybody for a prolonged period, because he's still coughing. He's got a fever. He's still contagious, until I figure out if the coronavirus testing comes back positive, which we've got a little lag. We haven't got our kits in yet, but we did test him for a strep. We did test him for flu, and those results will come back very, very quickly. In the meantime, I'm going to wait for my blood test results before I make any definitive tests, because I deem that he's not so sick. His oxygen level is 99%. His heart rate was 80. So as a physician, you make a judgment. So that leads me to the next point. I made the judgment on the phone on the first patient. I talked to this gentleman on the phone. It's always safer to talk to somebody on the phone to get an idea what to do. With this particular gentleman, we were on the phone with the ER as well, just to say, listen, if we think this guy's got corona or something infectious, if we sent him to the emergency room, could you test for corona? The answer is yes, but he would have to wait with the rest of the people for a prolonged period of time, which I didn't think was a good idea for him or people in the waiting room. And maybe they had a separate waiting area for respiratory illnesses. I'm not sure, but my patient and I made the judgment that we're going to manage this outside, because he's not sick enough to really stay in the hospital. Now, that's a judgment that you might want to talk to somebody about. So if you just got a sore throat, runny nose, cough, you might have a regular virus, you're still contagious. What would you do? Take precautions, wash your hands and all those good stuff. And what I'm going to describe about proactive stuff, you could do it for the regular virus, the flu, or the coronavirus, right? We'll finish on that note. And so we're going to take questions slowly as I continue my conversation. We're going to see some of the common questions that are going to come up, okay? So with the gentleman, we looked at other avenues, the ER or getting tested. The benefit of the ER would be that you get tested and they could tell him right away you have corona or you don't have corona. Hypothetically, if he got tested and he didn't have corona, well, that doesn't mean he's not contagious. He just doesn't have corona. And then they could probably test for flu. He may just have a virus. In any case, he's still contagious. He's got the fever, he's got coughing, and then we're going to figure out where this diarrhea is coming from. Is it part of this viral attack, or he's got two things going on? But with him, we sent him home. We told him to stay separate from the rest of the family. One member of the family can go down or go to a room and feed him or give him what he needs. Give him his entertainment, he'll be good. And so we will ride this out. Because with viruses, you can't give antiviral because we don't have any. With the flu, within the first 2 days, if you use Tamiflu and other antiviral, you can do that. And you just can't switch one antiviral and give it to another virus. There are other things that I think the FDA may rush and try to use as an antiviral. There's promise there. Even the vaccines are being, pushed through quickly, but it's going to take time, right? And God forbid, if this virus mutates, then that vaccine may not turn out to be as effective if the virus continues to keep changing. So the precautionary things I discussed, now we're going to talk about the proactive things, right? The proactive things is, how do you make your immune system stronger to be even prevent it in the first place? Should you be exposed to it, then you have minimal symptoms. As I keep telling you from the beginning, you can have two identical people and you could expose them to the same thing. One succumbs to it, the other doesn't, because one has a more robust immune system. It's very difficult by looking at somebody how to figure that out. We're going to go over some of the things that weaken people's immune system. Like if you have diabetics have a weaker immune system for multiple complicated reasons, not least because of lack of blood flow to certain areas, and the high sugar level compromises or makes the body prone to certain infections on the skin and so forth. And that's why diabetics have twice as many heart attacks for another day. But so diabetics are at increased risk. People with lung problems are at increased risk because this virus is a respiratory virus. And when it hits the respiratory system, it creates an inflammation, which can then create a problem between where the air and the blood meet to get the oxygenation, okay? And then that inflammation can damage that connection between the air sac and the blood vessel. And then in addition to that, there's things like oxidation. So some of the pathologies is that in the short term, it could be self-limiting, that you could have all the things I just described, but the immune system holds it at bay. It doesn't go any further. Or when it continues and progresses, then sometimes the body's own immune system, as it continues to send out these messengers called chemokines, cytokines, they then create this kind of perpetual inflammation, and then that can lead to a global inflammation in the lung, almost like a fluid-filled lung, and then the lung is stiff and you can't get air. Those are the people, long before that, they need to go to the hospital. They may even need to be on a ventilator, but you can't predict these things, right? So I would say that when you have a virus of any kind, you're contagious. If you have the flu, your body's hurting, everything's hurting, your skin is hurting, you're fatigued, you lose weight, no appetite. Everybody knows what a flu is if you've had it. I've had it once when I was a child, and I had it this winter, and I was able to get over it because I pumped myself with very high doses of vitamin D. I'm going to go over that as part of the repertoire to boost your immune system. And that flu was over in 5 days. How do I know it's flu? Because it's severe. It's your eyeballs hurt, your skin hurts, your muscles ache, you have chills, you have fever, you're shivering, you know all these. So nobody can deny or doubt flu because it has all these constellation of symptoms. And so with the corona, you could get some of that. But particularly if you have shortness of breath, that's when you need to seek medical advice on the phone, ideally, or give a call to the emergency room that if I come, where should I go? So just give notice and situations like that. Okay, so that's the time right now. So we're going to try to go to the proactive things, then take some of the questions. Okay, some of the proactive things is what are the 5 steps that you can boost your immune system? First, I'll generalize it, then I'll give you the science behind it. You must have adequate sleep. The one way to compromise your immune system is to disrupt the sleep. So easier said than done, right? So people often take it for granted. But one night of lack of sleep, your bowels go off. And the bowels go off, that's where the immune systems are. When you don't have sleep, your antioxidant level goes down. So there are multiple mechanisms we can prove to you. But so that's why having good sleep, 7 to 9 hours sleep, having restful sleep where you wake up rested, this is critical, right? So if you have sleep apnea, wear your sleep device, CPAP, BiPAP, wear it, okay? Try to go to bed early enough. Don't eat too late, close to bedtime, because as you get older, like myself, these will interfere with the quality of sleep. Don't eat foods with coloring, preservative chemicals. These are neuroirritative. So these will give you sleep, which is unrested. That means you may have slept 10 hours, but you wake up unrested, right? That's not a good idea, because sleep is probably the number one thing to support your immune system. It's the number one thing to damage your immune, and you can feed it right away. So you don't have to wait a week or two. Of course, the longer you disrupt sleep, the more the consequences. Number 2, don't put bad food in, because as I was just saying, it disrupts your sleep, it disrupts the bacterial flora. Your immunoglobulins that you make, a significant number come from the mucus lining in the gut lining. The gut is 26 feet long. It's a big organ. And the more we find out about the microbe and the interaction with the lining and the immune system, the more powerful it is. So sleep and the gut go hand in hand. Many data points to show that there are central communication between the brain and the intestines through the vagus nerve, which turn on inflammation or turn off inflammation. Again, inflammation will damage the immune system, and reducing inflammation is good for the immune system. So the sleep is very, very important. Don't put bad foods into your body, particularly coloring, chemical preservatives. Put good food in, because you're nourishing the body, not only for nutrients, but actually nutrients for your gut. So wholesome foods have fiber. These are digested by the bacteria. The bacteria flourish. We call that bacterial diversity. A good bacterial diversity is synonymous with lower inflammation, and the gut and the lining of the gut is where immunoglobulins are made. So that's why it's very important. So that's number 3. Number 4 is the supplementation. That's what we want to spend a little bit of time on. Supplementation. One of the most powerful things is maintain a good vitamin D level. Now may not be an easy time to get yourself tested, but have you been tested? If you've been tested and you're below 30, that's too low. The range is between 30 and 100. You need to be at 60 for an average person. If I have patients who are diabetic, I get them to 80 because I'm trying to reduce inflammation. I'm trying to prevent heart attacks in these people. Not that vitamin D will do it, but what I'm saying is that you need a synergy of nutrients that I'm going to tell you, which will be supportive of your immune system. So the one other class of patients who are susceptible is heart patients. Heart and lungs go hand in hand, right? The heart is pumping the blood to the lung is then sending oxygenated blood or around the body and so forth, right? So the lung, the heart are very, very critical. And then other metabolic problems, whether it's kidney disease or diabetes, these are people that have to take extra precaution. And the advice I'm giving is valid because they need it even more than others. So, for young people who might be so-called carriers, they're infected, they don't know about it, they're less likely to be infected if they are taking vitamin D. So young people less than 12 can take 1,000 units very easily. People who are, at least 80 pounds and over 12 years old could take 2,000 international units of vitamin D3 easily. Most people who are adults need minimum 5,000, and in many cases, even more than that. And how do I know? Because you test them. You test them regularly, so you see whether they're getting, the levels are too high or too low. So on average, 5,000 units of vitamin D. Should you get sick, you want to superdose it. So vitamin D3 superdosing means taking at least 10,000 a day. I take 50,000 a day for 3 or 4 days. That's when the viruses multiply. Now, the corona is special because it can continue to multiply for a week, maybe 2. So if I suspected corona or a bad virus, like I did when I had my flu in the Christmas period, I took 100,000, 50,000 in the morning, 50,000 at night, but only for that 5 days. So even I can get toxic in 5 days. If I continue at that rate, I'd become toxic. So that's one way. The other way is the most powerful antioxidant, or one of the most powerful antioxidants, is vitamin C. So as people tell you, it is a good antiviral. It is a good way to at least support the immune system. It by itself has a different pathway than vitamin D. Vitamin D works on natural killer cells. Vitamin C works on multiple systems, dendritic cells. It's an antioxidant. It supports connective tissue. It makes collagen stronger. So it's never one thing. We all in the medical profession want one treatment for one thing. With natural things, it never works that way. That's why having a synergy with omega-3 is very, very important, because omega-3, again, acutely is probably not the right answer, but the combination of vitamin C and omega-3 keeps inflammation down. But more importantly, maybe probiotic. Again, keeping the gut healthy with a good diet, don't put the bad things in, and taking a probiotic. Now, so these are proactive things. Proactive things, vitamin D, vitamin C, probably a fish oil, more for the long term as opposed to this short term. Don't forget, this virus is going to be around for months. So this is not a strategy for just 1 week. This is a strategy to continue for a period of time. And I'll continue to give you advice. So if you follow me on Instagram and can continue to follow me on Dr. Habib, that's DOCTOR, Habib, HABIB, I will continue to not only give you updated information on this virus and how it may be impacting people, but how being supportive and promoting your immune system can actually have global benefits. Because I'm going to discuss how the rest of the body is interconnected, how the immune system is the most powerful way to have longevity, to reduce inflammation, prevent heart attacks, even have better diabetic control, better sugar control. Because with the lower inflammation, the insulin is more sensitive, so your sugars are much easier to control. So the 5 steps are sleep, don't put bad things in, put good food in, then supplementation. We talk about the supplementation like vitamin C, vitamin D, omega-3, a probiotic. Now, what are the vitamins? It's more the other forms of vitamins. Other forms mean what other transportation mechanisms. So oral pills have to get absorbed through the gut lining, then into the bloodstream. And basically everything I've told you, I can measure. Liposomals are absorbed in a much more rapid manner. When they're absorbed, almost 100% will get absorbed into the body. And then they'll circulate around the body, and then the kidneys will pee out whatever it does not need. But before it does that, it goes through the gut lining into the lymphatic system. Your lymphatic system is where all your immune cells are circulating around. So it really has a way of sort of boosting the immune system, and is probably much more potent than oral pills, and almost as good as, say, IV. So IV nutrition is just it's a great way to 100% get what's in the vitamin into your body. Now, what it does at that point is the body uses it up by saturating the body, and then it engages systems, turns on system, and then it's eliminated through the kidney. So I've given a general impression about viruses and contagiousness And then more importantly, I wanted to talk about, what proactive steps to take. So for the clients that I described, one was an antibiotic treatment because it was a bronchitis. The second was a virus as of now. So I'm treating it in an antiviral manner. So all the things I advise you, that individual is already actually on it. So that's as good as you can get. So some of the questions that we're getting, let's see here.
Just ask them if you have any questions.
If you have any questions, send it my way. Also, what is your thoughts on L-lysine? I've heard that is good for other viral issues like shingles. Correct, okay? But like shingles is part of the herpes family. There are many in the herpes family. So chickenpox is in the herpes family. Shingles is a presentation of people who've been exposed to that virus, the varicella virus, right? So lysine, yes, as correctly said, it is, but it's not going to work for the coronavirus. So right now, from the knowledge that I have, for most common viruses, vitamin D is one of the most effective at preventing it. So let me give you anecdotal. So my kids, when they get a virus, which is rare nowadays because they go to school, they bring back stuff because I keep the vitamin D level, at least at 50. Okay, so I measure it and I keep it at 50. My kids range from 9.5 to 20. So each of them will keep that safe level and we monitor it. The other thing is when they get the virus on the first day or two, when the virus is multiplying, how do you know if they have a virus? Maybe they got a scratchy throat. Maybe they have a sore throat. Maybe they're coughing. Even if it's mild, I superdose of vitamin D. So even my 9.5-year-old who's about 80 pounds, I'll give her 50,000 units vitamin D for 2 or 3 days because that's the peak multiplication time. Now, coronavirus, as I keep saying, it's going to be a little longer, so you dose the vitamin D longer. So higher dose and, talk to your doctor, talk to your healthcare professional. But of course, my clients will ask me for advice.
A lot of people are asking about elderberry.
Elderberry is good. To be honest, I don't have a lot of information on botanicals because botanicals are very favorable. I tend to use botanicals for gut function, but elderberry, I think it may be good for the respiratory system, but I don't want to speak about those things. I do a lot on the vitamins and how the vitamins support the different organ systems in the body.
And people are asking, can you have too much vitamin D?
Can you have too much vitamin D? Okay, so look, for someone like me who measures these things, I'll tell you what mine is and many of my patients. Sometimes during the winter months, because we come down with a few things, like myself, after the flu, I was taking a heavy dose of vitamin D, and then I had just lingering problems. So, my levels went up to 115. So upper limit is 100. I've had mine go to 115. I've had some of my clients go to 150. All I do is just cut off the vitamin D temporarily, and the levels start to drop back, and I may remeasure in 2 to 3 weeks to see where we are. There is never a side effect from having levels of 112, 115, 150, but I don't recommend staying there for a long period of time because it is a fat-soluble vitamin. It's going to linger around the body. Vitamin D is supposed to absorb calcium more. So in people with calcium problems, calcium blockages, these are theoretical problems. But what I'm saying is that even if people get to high levels, it's very temporary. But we try to keep them in that range of 30 to 100, 60 being a good range for the average person who just wants to be healthy, 80 for people who want to really boost their immune system and stay in tip-top condition, like myself.
People are asking where they can get the vitamin D.
Vitamin D is
in the bio. Click the link in the bio.
Yeah, if you click the link in the bio, you'll be able to find that. But the form that you want is D3. When you get a prescription from your doctor for D2, you're not going to find the bioavailability. It's not going to be as well absorbed as the D3, which is over the counter. And then if you click the link below, you can see some of the good quality vitamins on that link. Okay, regarding something, should you do both fish oil and vitamin D? Yes, I mean, both are fat soluble. You can do them together. The message I want to say is that there's a synergy between them. When people have these mixed reviews about omega-3 being good for the heart, not being good for the heart, because no vitamin works on their own. In your body, no one system works on its own. What's incredible and what the studies are confirming, this integrated approach is the way. So the brain controls the gut controls the brain, and many things in between. So when we talk about this inflammation in the gut and the brain controls it through the vagus nerve, it does it through the spleen, through CD11. So, I'm not here to blow you away with science, but the more we learn, the more we see the interconnection. That's why studies which look at one variable, there are limitations. I won't say it's flawed. I say there's limitation. Therefore, for people like myself, I don't ever rely on one variable. I study, whatever studies that come out, which with one variable, that's great. But I tend to try to utilize synergy and look at the big picture, look at outcomes. Did I get the result? Did I bring down the sugar? Did I bring down the blood pressure? Did I bring down the inflammation? So mine is based on outcome using multiple combinations. Okay? That's where fish oil, vitamin D, great. But the fish oil is more to be synergistic with vitamin C, actually. Vitamin doesn't need any synergy. It works on everything from top to bottom.
Someone's asking about kombucha.
Kombucha is a vinegary product, right? And like apple cider vinegar, it is good for the biome in the gut, right? So that allows better fermentation. Fermentation is an environment that the bacteria like, because the bacteria take insoluble fibers, that means non-digestible fibers. So you eat wholesome food, some of it's soluble and some of it's insoluble. Well, the insoluble fiber is fermented by the bacteria. So it's apple cider vinegar and kombucha facilitate the environment for the bacteria to ferment more readily. And that fermentation process is ideal for the bacteria to produce short-chain fatty acids. And these short-chain fatty acids themselves create a diversity of bacteria, which is synonymous in reducing inflammation and also boosting the immune system. You know, not this instantaneous thing, more of a process, right?
Someone that's about colloidal silver.
Colloidal silver has antibacterial, antiviral, antiparasitic. So it's a good thing. It's in a very small dilution. So it's not going to be in heavy doses to have heavy metal toxicity, right? So there's a lot of good things about topical use, ingestion use. I don't tend to use it very much myself because I have so many other modalities that I use, but I have nothing against it. So when a lot of times people come down with something, they'll take that. And the people who use it, you want to get advice from them as to how effective it is and when they use it and so forth. For example, I was just in the shopping center today, big old line because everyone's buying stuff all of a sudden. And I recognized somebody and he pointed out what's in his shopping. It was curcumin, right? Turmeric, the whole turmeric. So what he said to me was, the last time I had allergies, you know, I got sniffles, I was going to turn to my Zyrtec. I ate a whole one of those, dipped it in honey, ate it, and my allergies went away. Now, it could be anecdotal, but it makes sense because all the studies about whole curcumin, whole turmeric is actually turning out to be globally beneficial. Not only the curcumin, which is anti-inflammatory, but the whole turmeric has the fiber, the indigestible fibers, good for the microbe. So you're seeing multiple benefits of flavonoids, anti-inflammatory, gut bacteria promoting of the whole turmeric. That's spice, whole turmeric. So you can have the powder, we can eat the root. Both. Maybe the root is better than the powder.
What form should we take probiotics?
Probiotic, okay. You're looking for diversity. So one category that's in favor now is spore forming. There's a couple of type of species that are more spore forming. But I think if you go for, again, if you click the link below, you will click the bio below, you'll see some of the ones that we're offering. And again, it'll be either spore forming or we have ones which are specially coated, because the problem with the probiotics is that the acid in your stomach can destroy a lot of them. The bile in your intestines can destroy a lot of them. So by the time it actually gets to the colon, the numbers may be minimal. So when you start off with billions, you don't end up with billions. But if they have special coating, the ones that we do, then obviously they're going to get activated once they get to the colon. So I would say that, you know, good brands is where you would have some sort of trusted. You trust those brands a little bit more. Someone at the workplace recently traveled, has no symptoms, but did not quarantine themselves. Should I be worried? It depends on where they travel to. Now, if they travel to an area that there's a high incidence, then they should, I mean, the advice has already been out. They should sort of self-quarantine themselves if they came back from travel, right? Look what happened from the people returning from Europe. They all congregated in one place, right? That's the worst possible thing when we're telling everybody, you know, safe social distancing and so forth. So it depends on where they travel from. And the incubation period can be from 4 days to 14 days, could be longer. And I think that whilst you're waiting, it's important to do the things to promote good health so you can minimize this carrier state, right? The idea is that the virus is in the body potentially, but you don't have any symptoms. Well, if you are a strong host, that means your body, you're a host, and the virus needs to live inside you, it's going to have an easier time living in a weak host. But if your immune system is strong, even if it gets in, it gets pushed out. That's, as far as common viruses, as I alluded to with my own family and vitamin D, it works. I can't tell you for this one because I'm not sure that any of my family members have been infected with corona, and I haven't used it in it. Again, how would we know? We've just started the testing. We'll be just starting the testing process. So that's really the biggest problem right now. The lack of knowledge. As the weeks go by, as the months go, the information will give us much more insight with specifics. What type of side effects brings for having fat burning supplement? Well, I mean, it's not really the talk on fat burning supplements, but let's connect up what we said about kombucha and fermented product, anything that nurtures good bacterial flora. What diverse bacterial flora do is activate AMPK. That's your fat burning in your liver cells and your muscle cells. So I've answered both things. Just fix your gut, eat well, put the right foods in, supplement it, nourish it, and that's good for the immune system, is good for metabolism as well. How much powder of the turmeric to take? If it's powder, it's a dessert spoon. Children, half. You can't overdose yourself on these things. Water soluble. Water soluble means that it'll circulate around the body. The kidneys will pee out whatever it doesn't need. Okay. So any other questions here? A lot of questions, but is it possible to overboost the immune system? I wish, and I'll answer that. We are doing vitamin D3 and K2, vitamin C, elderberry, fish oil. Sounds like you're pretty educated. K2 is made by gut bacteria. K2 helps the calcium go to the bones and stay away from the blood vessels. So this person is educated in understanding the health of the gut vessel. And the people interested in K2 are people who are worried about cardiovascular. Vitamin C is very good as an antioxidant. In combination with omega-3, lowers inflammation, which is good for diabetics, good for people at risk of heart attacks, and both of those categories, heart disease and diabetes, are at increased risk. So that's a separate question, not as relevant for the people with viral infection or bacterial infection. So just changing pace real quickly. Look, the signs of anything that is infectious, right, is probably contagious. In some ways, viruses may become more contagious. Sinus infection, not so contagious. Bronchitis, a little bit more because you're bringing it out. Pneumonia, more. But viruses are pretty contagious because it gets spread with the mucus and from the oropharyngeal area in the hands. You're touching things, you're coughing things out. So just take sensible precautions. Okay. Another question. Is there a multivitamin that you recommend to help with overall immune system? So multivitamins are not really designed for the immune system, but as I told you, everything is interconnected. So there is some synergy. But generally, with a multivitamin, you're looking at B complex for metabolism and energy. B complex drive the liver's function.
Does fasting help with the immune system?
Does fasting help with the immune system? Okay. Short term, yes. So when you're fasting, the immune system is engaged. But if you fast too long, meaning day after day after day, then maybe you'd be temporarily immune compromised or at least suppressed. So intermittent fasting, I think, will activate the immune system, but you take full advantage of that fasting if when you refeed, you feed with good things, right? Wholesome food, good food. I just don't think that that's the best strategy at this point. I think the best comparison I can tell you is versus someone who's overfeeding themselves, intermittent fasting is far superior at supporting the immune system than someone who's overfeeding themselves, because they're actually damaging the immune system. So if I wanted to choose either state, I would choose intermittent fasting. But for the general population that we're talking about, follow the avoidance, the things that protect you from safe distances and washing and covering your mouth, things like that. And the next is proactive with the being supportive of the immune system from the sleep. Don't eat the wrong foods, eat the good foods, and then supplementation. And that intermittent fasting would be somewhere down the line for this acute kind of a problem. Intermittent fasting will give you much more reward when you can maintain it over a period of time. Over a day or two, I'm not convinced that it's going to be of great help for this kind of exposure to viruses and trying to prevent it. What other questions? The black seed, look, I don't know a lot about it, but it has a lot of health benefits. And I would say that if you like it and you eat it, you're good. I don't have lab data on it, so I'm a physician, so I try to go where I'm objective. So if I had 10 people at least on it, and I can see and track where they're at, I could give you information, but I can't really give you objective data. Whereas with whether people are having a good diet or they're taking supplements, I can measure them. So if they're taking a good diet, I can tell you, did it get absorbed? If you're taking a supplement, did you get enough or did you get too much? If you don't measure, I don't know anybody who can look at somebody and say, you're too much or too little. You got to measure, and that includes the vitamin D. Okay. What else?
Should kids take D3?
Absolutely, kids should take D3. In fact, I think there were studies to show that newborns within the first year of life, when they took about 1,000 units of vitamin D3, had less allergies. Okay, so there's a lot of things to learn. There's a lot of floaters over there. Is that people
Just like
responding? Okay, that's cool. And joined late. I apologize. Can you give a takeaway to a layman on how to boost your immune system? Okay, I'll just go over the how to boost your immune system, 5 principles. And this applies to many, many, many things, and not least this. Don't damage the sleep. One night of bad sleep, immune system suppressed. You'll see changes in your skin. You'll see changes in your bowel function if you pay attention. Number 2, putting in bad foods, processed foods, will disrupt your sleep, will alter the bacterial diversity of your gut. Putting in good foods allow the bacteria to flourish, and the bacteria make the lining more productive, so more immunoglobulins are produced. And then number 3, you supplementing with vitamin C, vitamin D, omega-3, and I said fish oil, right? So vitamin D, vitamin C, omega-3 is fish oil, and other antioxidants. And so that's the immune system. Any other quick questions here? Overall immune system. Let's just change pace for people. Again, a lot of times we say the young people are not affected, so why should they care? But that's why the lockdown's happening in Maryland and DC, is because the young people could be infected. They don't know about it because they have no symptoms. About 80% of the people have very little symptoms to no symptoms, but that 20% may have mild symptoms or severe. Now, for the 80% who are fine, they may not know that they have the infection. They may give it to somebody with heart disease or lung disease, and they may have other medical problems like kidney problems, liver problems, diabetes. So I think that the main thing with the people with the medical problems is control those blood pressure, the sugar as best you can. Control your underlying problem, the asthma, the best you can. With conventional medicine, frankly, it doesn't matter. And then beyond that, you can still then boost your immune system with good sleep, good food, and supplementation. I think now's not the time to panic. It's reasonable to follow instructions, and I think that people need to just go on their day-to-day business where it's essential and where it's like going to the movies and so forth, just cut it down over the next few weeks, and let's just see what happens. As I said, I'll continue to give you information on my Instagram, and we'll continue to engage, and I'll give you more stories of real life people coming in or calling in, and how that's matching with the information out there. There's going to be variations throughout the country. There's going to be variations throughout the state. There are pockets, right? So this is the nature of it. This is not, it's a moving target. All right, how can someone with no symptoms able to give others the virus? Well, this is what we mean by the so-called carrier. It's not strictly Peter carrier. Strictly speaking, it's not carrier. They're incubating it, right? The incubation means that you've got the virus is sitting and multiplying. And until it reaches a certain threshold, you may not have any symptoms. And even when it reaches a certain threshold, if your immune system is strong, you may not display the symptoms. But the incubation means that the virus is multiplying. So theoretically, again, it's hard to imagine how the virus can be spread to somebody without some kind of mucus, without some kind of cough. So, but again, these are unknowns. We don't know. It may be people can spread without any mucus, without coughing, without fever, maybe, so we just don't know. But that's what they're saying, is that with this pandemic, there's something special about this, which is unlike the regular virus. There's something that makes this even worse than the flu, and that's the unknown. We don't know. And so what we're saying here is that because of its rapid spread, they suspect that even when it's inside the body, incubating is multiplying, that it can still potentially be infectious. When you're coughing, you're more contagious. It'll be more infectious. When you have a fever, it's likely that the virus is stronger. These are just clues to kind of differentiate.
What about lupus patients? Are they at high risk?
Yeah, lupus patients are going to be at high risk. So anybody with inflammatory conditions. So lupus is an autoimmune disease. It's synonymous with inflammation. Now, specifically joints, but it can be in the skin. Lupus can even go to the lungs. Rheumatoid, again, the joint. Rheumatoid can go to the lungs. It can go to the spleen. These autoimmune diseases are usually multi-system. That means that it could be multiple systems, and it's inflammatory. And so anybody that has inflammatory conditions, anybody has autoimmune, they definitely are going to be at increased risk, because those people that inflammation is compromising their state. Now, being on medication, keeping it under control, in some ways is good, but then if you're using immunosuppressants, you're at high risk. So for example, even steroids are immunosuppressive. That means if you take it for more than a few days, it now is suppressing your immune system. When you're on treatment for rheumatoid, lupus, like Enbrel, and these kind of immunosuppressants, you're more susceptible to all infections. So the underlying condition of autoimmune disease and inflammatory conditions, whether it's inflammatory bowel disease, whether it's autoimmune disease affecting joints or skin, these themselves put you on the more risk of for any type of infection. And the treatments, particularly the ones that suppress the immune system, clearly that's why on the warning label say you should get tested for TB before you even go on the medication. Because if you go on the medication with some TB exposure, TB is going to become florid. It's going to be systemic. It's going to be all over the body, much more serious. Okay, that's why, because the immune system. Okay, so I think we've spent a good amount of time. Hopefully that helped. Maybe we'll do this again. And do follow me on Instagram. That's Dr. spelled out DOCTOR Habib HABIB. And stay safe and stay. I didn't mention hydration, right? Hydration is very important for the body to work right. Okay, so for now, take care. Bye bye.